Hello, my name is Dr. Oliver Firth, and I'd like to just run you through a brief neurological examination for the purposes of assessing a diver. So firstly, we'd like to establish orientation in person, place and time. So we do this by asking the diver their name.
Poppy Reed.
Thank you, and your date of birth.
18th of July 1988.
And you know where you are now?
The London Diving Chamber.
Very good. So, what we're going to do now is assess sensation and muscle movement in the face. We do this firstly by asking the diver to close their eyes, and then touching them on the face, asking them to say yes when they feel someone touching. So, just say yes when you feel me touch your face.
Yes. 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 Yes.
That's excellent. You can open your eyes now. What I'm going to get you to do next is scrunch them up very tightly. So scrunch your eyes up tight. I'm going to try and prise them open, keep them shut. Good. Open them now. Blow your cheeks out. Good. Can you bare your teeth for me? Show me your grin. That's it. Now open your mouth wide. Good. And I want you to stick your tongue out and wiggle it up and down. Fantastic. Thank you. Ideally, you'd also like to make an assessment of the pupils, looking for equal sizes and reactivity to bright light. They should constrict when a bright light is applied. Next, we're going to assess hearing very crudely by just making a rustling noise with fingers and thumb and applying this to each ear separately and asking whether the diver can hear these things the same both sides. So, can you hear this?
Yes.
Can you hear this?
Yes.
And just comparing the two, do they sound equal on both sides?
Yes.
Okay, great. Assess the upper limbs in terms of sensation and movement. We do this by asking the diver to shut their eyes again and asking them to say yes when they feel sensation. So if you'd shut your eyes please, and just let me know when you're, by saying yes when you feel me touch you.
Yes. 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 Yes.
Okay, that's great. You want to do that in various points up and down the entire upper limb. In terms of assessing movement, this is done by exercising various muscles against resistance. So firstly, if you could shrug your shoulders up in the air, I'm going to push down. I want you to push up against me. That's good. Now if you could put your arms in front of you like this, and I'm going to stand here. If you push me away from me, as hard as you can. Now pull me towards you. Very good. Could you stretch your arms out, spread your fingers, keep them widely spread. Just testing the grip there. And then if you could turn the palms up, and I want you just to squeeze my fingers now as tightly as you can. That's great. Well done. Thank you. That assesses grip strength. Tests of coordination are useful here. Could you play the piano for me? That's great. And I want you just to tap the top of your hand as well. And the other way too. So those are fairly crude tests of coordination, but if the diver can do those, then we know that their coordination is reasonably good in the upper limbs. Next we're going to move on to the lower limbs, and for this you need the diver lying down. So if you could lie down please. Thank you. With the diver lying flat, we're now going to assess sensation and movements in the lower limbs. So again, with the eyes closed, you ask the diver to say yes when they feel you touch them on various points on the lower limbs. So if you could just say yes when you feel me touching you.
Yes. 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 Yes.
Excellent. Now we assess movements. And this is most easily done by asking the diver to lift the entire leg in the air against resistance. So if you could just lift your right leg right up in the air, that's great. And now push down hard as you can, very good. And you just want to assess and compare the power left and right. So you could do the same, lift up in the other leg, push down as hard as you can, very good. Now I'd like you to bend your knee And what you want to do here is assess the power in the knee joint. You do this by asking the diver to lift the heel up towards their bottom against resistance. So could you pull your heel up towards your bottom? That's good. And now push it straight, try and straighten your leg. Great. And we do that on both legs again, so heel up towards your bottom and push straight again. Fantastic, thank you. Okay, so now we're going to assess the coordination and gait. So this requires the diver to stand, and if you could just walk normally for me in a straight line. Okay, and turn around and back again. Very good. And now if you could just walk on your heels like this. Okay, and turn around and walk back on your tiptoes. That's fantastic. All right, finally we just assess what's called heel-toe walk. So if you could just walk one foot in front of the other like that, in a straight line. You're looking here for any sign of imbalance or dizziness. That's great, thank you. What we do next is look for other signs of cerebellar problems. So if you could stand here and just stand with your eyes shut and your arms stretched, palms upwards, and you just observe here for any swaying of the arms, any drifting of the arms, and general stability. And now, keeping your eyes shut, if you could just touch the tip of your nose with the finger of your left hand, any finger. That's great. And straighten it out and do the same on the other side. And this is a good test of upper limb coordination again. And that completes your diver assessment. Thank you very much.